Welcome to ETMC TV and this informative presentation by David Lawrence Young, MD, board-certified and fellowship-trained surgeon. Dr. Young will discuss gallbladder surgery using the Vinci single-site system. Thank you for choosing ETMC TV.
Many people in society have problems with gallbladder disease, and gallstones themselves are quite prevalent. 20% of the general population have gallstones, and of that percentage of patients, about 5 to 10% will ultimately need surgery for their gallbladder. And so this is a commonly encountered problem in my practice of medicine. Typically, the symptoms that folks will present with are nausea, vomiting, upper abdominal discomfort, and frequently it's right below the breastbone or in the right upper quadrant of the abdominal area. And pain can radiate through to their back between the shoulder blades, or can radiate to one or the other shoulders. Traditionally, the gallbladder was removed in the old days through a right upper quadrant incision underneath the ribs on the right side. It was quite painful. It was a muscle splitting incision. In the mid-'80s, laparoscopic surgery came to the forefront, and laparoscopic surgery's advantages were and are that a minimally invasive approach could be applied to the same disease process, whereby several small incisions can be made and working ports can be established, and it'll allow us to remove the gallbladder in a minimally invasive fashion. Most recently, with the development of general surgery applications for the Da Vinci robot, we can now apply robotic surgery to the treatment of gallbladder disease. And this allows us to approach the gallbladder surgically through a single incision, thereby circumventing having to make multiple incisions. And the surgery can be performed through a 2.5 centimeter incision made within the belly button or the umbilical area, and is virtually scarless. Minimal trocar sites translates to minimal pain. There's less pain than with traditional laparoscopic surgery, and the patients are very satisfied and have fewer scars and less pain. The Da Vinci robot is a device that allows us to perform a surgical procedure. An advantage of the Da Vinci robot are that we have improved visualization of the operative field and a three-dimensional view of the surgical area in which we're working. It also allows us to magnify and zoom into the area, and has high definition visualization of the operative field. The Da Vinci robot allows us to work within a very confined space in a precise and effective manner. The robot performs only the movements and instructions that the surgeon instructs it to do, and allows for very precise and effective movement within a confined operative field. The surgeon is completely in charge and in control of the entire operation. It simply affords improved visualization of the operative field, improved precision in terms of movements with the instruments. At no point is the robot in an automatic mode. At no point is the robot in an automated mode. At no point is the robot allowed to make any movements or do any kind of portion of the procedure without the direct input, oversight of the surgeon. I feel that it's a wonderfully safe technique. I've just been very impressed with the precision and the improved visualization that we have with this technique over laparoscopy. The goal would be to restore the patient to their previous state of good health and improve their quality of life with a minimally invasive approach, with minimal scarring and a minimal amount of pain. And it's an outpatient procedure, so the patient will come in, have their procedure, and then go home the same day. It's exciting because the robotic surgery is not offered at all facilities. It's not widely available in all communities. The wonderful thing about having the robot here in Tyler is that this is a cutting-edge surgical technique that's available to East Texans at East Texas Medical Center. And we're very blessed and fortunate to have access to this technology and have the ability to utilize this for our friends and neighbors. Patients are excited and they show you their scar. It's hard to find because it's hidden within the belly button, and they're ecstatic and they're smiling and they're happy and they're pleased to have had less discomfort and minimal scarring.
Dr. Young sees patients at 700 Olympic Plaza, Suite 510. To make an appointment, please call 903-595-2636. Dr. David Young is a board-certified surgeon and is a member of the East Texas Vascular Associates.
I attended Baylor University for undergraduate training, received a Bachelor of Science in Biology, graduated in '89, and received my Master's of Clinical Gerontology in '90. And I attended Texas A&M Health Sciences Center and received my Doctorate of Medicine in 1994. I performed my surgical training at Georgia Baptist in Atlanta, and graduated as chief resident in 1999. I'm a diplomat of the American Board of Surgery, and I'm a fellow of the American College of Surgeons.